Like the doctor can be in the US and there can be a machine doing surgery on someone in Africa or South America or India even, right? So that's there also now. There are hospital management softwares that really use AI today.
AI in healthcare today is the market size is about $16 billion and is it growing at a staggering rate of 40% CAGR and reach $180 billion by the year end 2030. So today to talk about healthcare and AI, I have my friend Atul from Buckle Consult UA. Welcome Atul.
Hi Azan. Yeah, I think healthcare is naturally an industry where AI was bound to, help out a lot or support a lot. I mean, everyone knows AI is it's not a new term. The term has been coined like 50, 60 years ago, more than 60 years ago. And it's been used in healthcare at least for, I don't know, since the 80s. Because, few reasons I think why AI is like a perfect contender to be used in healthcare is that it's the earliest digitized industry that we know of. It's been digitized early on because, of course, all of the professionals involved in healthcare, the doctors, nurses, pharmaceuticals, all of that, they're very skilled. So I don't think there was an adoption problem at all for technology and IT as such. And over the years, I can imagine the amount of data that we actually have on healthcare. And yeah, I think before they were generally used for faster data collection and data processing, right? But now, I think we are at the stage where we can actually take insights on all of this data, right?
So Atul, today what we see as AI, it definitely is something that has evolved over a period of time, right? So what do you think was the earlier days of AI and how did it help in healthcare sector, right? It would have been very rudimentary or very small at that point of time, but there was a huge impact. So can you throw some light on?
Yeah, so earliest uses of AI in healthcare, basically doing testing, digitizing, and I wouldn't call that AI as such. Maybe there was not too much processing compared to the AI today. But tech in general, from the 80s and the 90s, it was mostly focused on data collection, processing, storing, so that you move from hospital to hospital and your record's always there, and it's printed out and it's sent from lab to lab and all of that. Then radiology was, ever since all of these X-ray machines and a lot of medical imaging software started coming up, I think along with the dot-com bubble in the 90s and all of that really opened up ways for AI to help, because imaging is very data rich, right? I think in today's time a lot of the imaging that radiologists do is actually assisted by AI, where it basically points out certain maybe cancers or bones or pigments or something, any sort of medical image that you have. It gives, even if you go to the hospital for some checkup, and if you had to take an X-ray, when you get the X-ray today and when you look at it, you see certain sections marked and it's traced, and there are certain percentages that are shown, 52% this color, discoloration or gray, or of course it could mean different things for different body parts and different doctors. But yeah, that's where it started. Then it's moved on to so many other things like robotic surgery. Now you can like the doctor can be in the US and there can be a machine doing surgery on someone in Africa or South America or India even, right? So that's there also now. There are hospital management softwares that really use AI today. So on the supply chain side, so hospital is somewhere, if you don't have enough materials, then it's a big problem, right? So they have to really keep their supply chain guidelines and principles like to the point, and that has been done over the years by a completely separate vertical of staff. So we don't see in hospitals at all. We usually we talk to the receptionist, we ask for a room or whatever, and talk to the doctor or the nurse, right? But there is this shadow, department in hospitals where they take care of things like inventory and all of that. And I think without AI, it would be very hard to predict all of that. So a lot of demand planning, predictive algorithms are used to see, when they should order what, I mean, if it's because these things, there's a lot on back order. So
Right.
with the back orders, they sometimes get oversupply, sometimes get undersupply, right? So some diseases are seasonal. There's flu season, right? So for flu season, you may need different drugs, different things. There's all of that, right?
So it's become like a part of the whole process and the life cycle. We don't realize, but it is actually happening behind the scenes.
Yes, definitely. Like it's a very complex problem. So I mean, traditionally, either you have a big team handling a complex problem, or you try to use data to find simpler solutions that can assist your decisions. So yeah.
Right.
So right now they're able to basically manage all of that through AI and make sure there's no shortages. Of course, I mean, there are some things AI cannot fix, like for example, when there was COVID, that is something that came out of nowhere. So I mean, there were situations where I think even the AI needed some training or retraining and help. But I mean, with every anomaly in society, I think the AI also learns. Right? So
Learns.
next time there's something like this, it'll be ready.